Do you suffer from high blood pressure? And is your high blood pressure unresponsive to hypertensive medications? If so, then the cause of your hypertension is probably one of the mechanisms that is not impacted by hypertension medications. What are those mechanisms? Well, there are multiple, and that's what I want to cover today. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. So what are the mechanisms that could be driving your high blood pressure that would not be impacted by hypertensive meds? Well, the first is insulin resistance. If you're struggling with insulin resistance and blood sugar issues related to that, that could be driving your hypertension. Insulin increases sodium retention, which increases water retention, which can drive your high blood pressure. Another related mechanism is weight gain. Gaining weight increases inflammation. Inflammation holds water, and that can drive hypertension. And then there's obvious interplay and loops between gaining weight and insulin resistance and gaining weight. Another mechanism that could drive your hypertension is stress, also known as sympathetic nervous system activation. Stress shunts blood to the periphery, to your arms and legs, so you can fight or flight, and it decreases blood supply to the GI tract. So this decreased blood supply to the GI tract contributes to intestinal permeability, also known as leaky gut. And so there's an interplay between stress and that causing leaky gut, and then leaky gut playing back into more stress because the leakiness allows in microbes and their metabolites, which drive inflammation and start this vicious cycle. Lastly is immune dysfunction. Up to 80% of the immune system is in the gut, and so if we have intestinal permeability, then we're going to have immune activation, and that immune activation leads to further intestinal permeability if it becomes chronic, and we have these vicious cycles that drive all kinds of pathology, including hypertension. So if you are on high blood pressure medications and they are not lowering your blood pressure like you or your doctor would like to see it, then there's probably mechanisms outside the control of those medications that are driving your high blood pressure. Working with a doctor that understands the possible mechanisms, how to find them, and how to deal with them will be key to optimizing your high blood pressure and optimizing your cardiovascular risk and cardiovascular health for the long term. Seek out a functional medicine practitioner that can help you solve this puzzle.